Gumlift was developed by Dr. Chow in California several years back, and now he's educating other doctors in his patented technique. Gumlift deals with gum recession, where for whatever reason the gums have receded and going towards the root tip, exposing the roots. In years past, we've done free gingival grafts where you rob tissue out of the roof of the mouth, take it out of the mouth, and then put it back in the mouth in another location, kind of like a free graft on the skin. The Gumlift is just a newer procedure, technology that is more benign, less invasive, and gives less post-op problems than procedures in years past. But basically, what the Gumlift is a one-day appointment, one-day procedure, where you actually take the gum tissue, and say if this was a lower jaw, and you just loosen it up from the bone, and then you raise it back up to the neck of the teeth, and then you use collagen fibers to support that lip where it won't drop back down. And of course, what happens is the gums reattach back to the bone and actually reattach to the root structure to, again, be where they used to be. The benefits to the patients is, first of all, it gives them a beautiful smile. There's nothing more unsightly to smile when you see half the roots when you smile. The other thing it does is it makes them a lot less susceptible to root decay. Unlike the crown of a tooth, roots don't have any enamel. Being such, when roots are exposed, they're a lot more susceptible to decay. Recovery, as far as completely healing and getting back to a normal life, you're looking at probably 6 or 8 weeks. The biggest thing with the Gumlift is post-op care. You have to be very meticulous in how you clean your teeth. You have to be very meticulous in the foods you eat. You don't want to do anything to jeopardize that Gumlift from moving back down to where it used to be.